Good morning. I particularly want to add my thanks to Lou's staff and to Lou. I think I was here either at the first or the second Elder Law Forum, and it has grown incredibly, and that is a testament to Lou, as well as his staff and his colleagues, and many of you in this room who are all seeking a place you can go to get information together, updates, and this is a very unique time to be getting this update. Before I start the formal part of my talk, I want to introduce someone in the audience. Michael Chittenden, if you would stand up, is our new director of the Center for Home and Community-Based Services. And Mike, I hope you will have the time today to meet some of these great people in the room. Mike has the Division of Quality and Surveillance, so he has the home care and hospice, licensed home care service agencies, certified and hospice oversight for surveillance, as well as the Bureau of Community Integration, where he oversees the Nursing Home Transition and Diversion Waiver, TBI waiver, the Bureau of Alzheimer's Disease Program, Money Follows the Person, and the Partnership for Long-Term Care. Good luck, Mike. Although I was asked to provide an update today on the Master Plan for Aging, I'm going to take the liberty to provide not only an update, but some reflections and observations. As I have been a participant in the Master Plan for Aging process, as well as an observer always. So I hope you will bear with me as I talk about some of the things that have gotten in our way and some of the strengths that we now can rely on with the Master Plan for Aging. Uh-oh, we're going the wrong way. There we go. The demographics in New York State have shifted and will continue to shift. The year 2010 was the last time there was an approximate match between the number of working age individuals and those who were going to need the care. Now, by the way, I said working age individuals, that's not everyone going into healthcare. That's people like us who have jobs. So many have questioned whether or not this was the right time to undertake a Master Plan for Aging. And why did we? Particularly since the challenges are large and we are on a very short time frame, which I will come back to in a minute. But it is precisely because of these challenges that we should undertake a Master Plan for Aging. Because if we don't do it now, those challenges will continue to grow and we will be unprepared to meet them in the future. There are also economic shifts and technological changes, particularly technology. And I believe that today you will have an opportunity to see a demonstration that will really convince you of the potential for the future. However, technology, as fast as it is rapidly changing, may not be fast enough to keep up with everything that we need. So the rate of change is unsettling and it's confounding. And here we are with the baby boomers. They were the first of the baby boomers were born in 1946. The baby boom lasted through 1964. We are facing 20 years ahead of us before that population, which I am part of, by the way, moves through the system. I keep doing this, sorry. So the executive order creating the Master Plan for Aging was signed in November of 22. And the Department of Health and the State Office for the Aging began to set up a process and a staff who could support that process, began to do outreach and structure. And the master plan is still a process at this time. I want to allay any rumors or fears in this room that the master plan has been written. It has not. All right? The executive order, as you will see on this slide, refers to a blueprint of strategies created through the coordination of existing and new state policy and programs. In other words, there's programs on which to build. That is why we have a master plan council, which is composed of 19 state agencies that are the home for these various programs. Anyone who has built a structure using a blueprint knows that it is two-dimensional, and once the construction begins, the plans are sometimes revised. Moreover, over time, the building may be expanded, added to as the needs of its inhabitants change over time. I believe that those in this room who are committed to this process share the goal that is stated on this slide, for older New Yorkers to live fulfilling lives in the best health possible with freedom, dignity, and independence, in a place where there are others to support them and companionship and community as well. So some of the observations that I promised to make. We are attempting to build an ecosystem for aging that facilitates healthy aging. And to do this, we are building from a position of strength. The proposals that we put forth in the master plan are built upon many years, in fact, about 50 years of commitment to home and community-based services. Services, policies, efforts towards enhancing the quality of life. And these efforts were recognized in 2017 when New York became the first age-friendly state in the nation. Today, after 7 years of work, and I'm going to emphasize 7 years, because nothing is quick, and we are going to have patience. Today, we have 300 health systems across the state of New York that are designated as age-friendly health systems. They include not only hospitals and nursing homes, but now home care and other centers. What's important about the age-friendly is that it's a movement. It is a group of people. It is a robust collaborative. Now, what does that mean? It means that each of these systems shares what they are doing with one another, so they are learning from one another. These are people who have the ability to teach one another. They also adopt techniques of spread. They have a robust communication plan, and they continually revisit and retool their effort. Now, why do you think that I'm pointing to that effort? Because that's what we are going to need for the master plan for aging in New York to succeed. So here is the real update. We have pushed the pause button. We are reflecting. This is a time of reflection for all of us. We set up 8 subcommittees, 33 work groups, 15 town halls were held across the state. We did a survey for which we have 10,000 responses. That survey will now go to our colleagues at the State Office for the Aging, who do a very robust survey themselves, a scientific survey, a needs assessment, community by community. It's online, I believe, at this time, Greg, and everyone can access it. And we will add those results together. We had over 650 meetings, and we had over 500 people who engaged in the process on a regular basis. Just for the heck of it, can I see how many people in this room might have participated in the master plan for aging? Thank you. And it was regular, and it may have seemed constant to many of you in the room. The work groups have now been paused so that we can do the following. We can take all of the recommendations. They number over 111, and that's cutting short the real span of all of these recommendations, because in some instances, under each recommendation, you can find 10, 12, 15 different steps, and so they are mini recommendations that enliven the major recommendation. So our process deliberately was large and broad and inclusive. So to some people, that meant that it was a little busy. It has also yielded a lot to work with. It is very difficult to take all of these recommendations now and put them into a coherent plan. That is why we have paused. However, let me focus on what the strength is of this point in time with respect to the master plan process. First of all, we have up to this point created not a plan, but a process. We created a community of people who now have new relationships with one another and have worked together over approximately a 2-year period. That is a strength for us to build on. In addition, we will need to do more work. Why? Because there were certain areas of the master plan that do not have enough ideas yet. I'll give you a good example. I don't think that we have really pulled together all that's possible in the area of technology. I don't think we've created the kind of resource for people that names all of the different technologies that are in use now, in use in homes to support seniors and their caregivers. There are some other areas that weren't quite ripe yet, if you will. I think the state of New York is looking very closely at housing. I think people here know that that was part of the budget discussion this year early on, and that is another area that is still growing and will be shaped over the next few years. And New York has a very robust history of home and community-based services. One other thing that I want to acknowledge, because I think it's very important to this point in time, and I think it's already been referenced earlier in the last panel of legislators. New York has the shortest time between the date that the governor is required to submit a budget, and it must be completed by the start of the fiscal year, although it was, as noted, late this year. And our Constitution also requires that we take care of those who cannot care for themselves. This is part of our heritage. This is part of our culture. It's one of the reasons we have some of the strongest advocacy organizations in the country, many of whom are in this room right now. We are a complex state. We are a noisy state. We are an advocacy state. And I have to say, and I have to recognize that people at the end of this budget session are left with, I think, fear that also translates into, at times, anger. And I do understand that. I want to acknowledge it because I think at the heart of this feeling that has been expressed and will continue to be expressed is the care for the people, their constituents, the workers. That's what I hear repeatedly in this room. So let's be respectful of one another's feelings and where each other are at this point in time, the disappointment that some people feel, and the fact that we will return again. And I want to say that I think some of that disappointment comes from the fact that there were expectations that the master plan would do more earlier, sooner, and would assist with the budget. Okay. This is an anticipated timeline. Why did I say anticipated? Because to do a really good master plan. And by the way, there will never be a perfect master plan. We need to take this time of reflection. We need to use our staffs in both the State Office for the Aging and the Department of Health to work on those recommendations, to identify where they could be better. But most importantly, we have to organize them in a way that do two things: that our stakeholder advisory committee and our council, meaning the state agencies, can use them effectively to put them into some order. And second, we have to make sure that we have captured every one of the recommendations. And why is that? It's because people care about the time that they devoted to this effort, and they care about being heard. That is important, that is essential. So, as you can see here, we are now headed towards early 2025. However, that will not be a date that we are stuck with. Why is that? Because the real work of the master plan goes on. It will never be a living, breathing document. It will never meet the hopes and aspirations of the people in this room unless all of us continue to work on it together. We need to measure, we need to revisit, because there will be changes over time. We will need to alter the master plan. We will need to identify what's working. We will need to spread the effective programs from one community to another. And where we do not have the resources, and please do not leave this meeting today without understanding, there will be places we do not currently have the bodies. We will need to continue a generative process that comes forth with more ideas, more solutions, more ways to address people's needs. And we must always remember that the one thing I believe that people are yearning for is that someone listens to them, someone notices them, someone connects with them, and someone cares about them. And with that, I have ended my presentation. Lou, do we have a few minutes, or shall I turn to my colleague Greg Olsen and let him? I have only till about 10. I see there's a question or two, and then I'm going to turn it over to my friend and colleague Greg Olsen.
Yes, good morning. Thank you so much for your presentation. It was very informative. I'm Donna Beal, Executive Director of Mercy Care for the Adirondacks, and I'm part of the Master Plan for Aging statewide coalition, but I am not part of the formal state committees. We receive no government funding. I just want to make that clear. We're sponsored by the Sisters of Mercy. In the Master Plan for Aging, there must be a larger role for the Aging Services Network. The New York State Office for the Aging has been so supportive of programs in the North Country and the Adirondacks. And just looking at the budget results this year, it was really disappointing to see, and we've been so supportive of the Master Plan for Aging. We're doing local grassroots raising awareness about this with a special campaign. We have members from 4 different counties up there. So I am just urging you to please elevate the role of the New York State Office for the Aging as the master plan is developed. Thank you.
Thank you, because you've given me another opportunity to make another observation. One of the challenges we will face, and we've already come up against it, is how do you take the healthcare system and the aging system and not integrate the two offices? So don't leave here thinking that I'm saying we're combining the offices. How do we, the healthcare system and the aging system, figure out how to work together and wrap our services around people? Because really that's what we need to do. In terms of the workforce, There are collaboratives around the state right now that are figuring out how to make use of the resources they have. How do you use community paramedicine when you don't have nurses? How do you use other day settings? How do you use technology to monitor people? These are the kinds of ideas that we have to be at the table together. And I hear I can learn a lot from what happened up in the Adirondacks. Dr. Heslin told me about a lot of work that went on. Okay, other questions?
One more, Carol.
Okay.
Hello, I work independently in the community, not in an organization or a government, so I just see a need and follow up and look for people to talk to about it. I want to get dental care on the radar for people on Medicaid because there is no dental care. I have a client who was needing a tooth pulled and the services were not there. She now has a $700 dental bill to pay, and she really can't afford it. But it was the only option for her to just go to a private dentist to get it pulled because there is no place. I called my county dental health county department. They have a dental department, and they gave me a list of places that took Medicaid, and it was 5 years out of date. And so if at least we could provide lists to our counties or to our states of active places people on Medicaid can receive services. I made phone calls to 3 of them that were active, and they put me on a 6-month waiting list to get an appointment that was more than 6 or 8 months out. So we're talking a year to just get an appointment for a cleaning for those on Medicaid. So after all of this time, they still have not called back with an appointment. So it's been a year on the list and still not called for an appointment. So right now there is 0 dental services for those on Medicaid.
If I can, let me thank you, because you are absolutely right. This is an idea I'm going to take back. It's needed. Dental health is physical health, all right? They're connected. And so we really do need to make sure we emphasize that, and I want to thank you. I want to thank Lou as well, and I will let you introduce Greg Olsen. Thank you very much.
Carol, thank you so much. So Carol mentioned one thing that is a pervasive problem in our systems, and that is silos. We have so many different silos and segmentation with no coordination. And you heard Rebecca Prevey, and applause to Rebecca. They did a study just looking at people and matching Medicare supplement policies and finding the right policies. You're going to hear from Alicia Kelly from CDPHP about their Medicare Advantage plan. Some benefits are good, some benefits are not. It has to match the person, but they have a $1,500 dental benefit inside of the Medicare Advantage plan. So people who are dual eligibles, Medicare and Medicaid, have to look not just at the Medicaid side, but also at the Medicare side, and what is the right policy for their particular needs. And that's some education that can be done through the Aging Network. In New York for years, you come on up, Greg, for years we have had a Medicaid system that soaked every dollar from the federal government that it could, to the point where in the state government, Medicaid became a verb. Oh, we have a problem, let's Medicate it. Let's bring Medicaid into New York and Medicaid programs into New York. But it has become myopic that every service has to run through Medicaid. And Greg is going to talk about the network that saves money for the state and serves 4.6 million people at a fraction of the cost of what Medicaid provides. Greg is the acting director of the New York State Office for Aging. I first met him when he was driving a snowplow about 30 years ago. He's responsible for federal and state programs. He is one of the leaders in the country in innovating services in the community, and he's going to tell you about that. And under his leadership, New York State and the New York State Office for Aging has become a beacon federally, and Greg has spoken all around the country on the innovations, and with that, he's going to talk to you about those innovations. Thanks, Lou. Thanks, Greg.
Well, good morning, everybody, and good morning to those online. 2 quick things. Lou looks fantastic on this TV right here, and I had way more hair in that picture than I do now, and so that's troubling. see if I can, okay, there we go. Well, I want to thank Lou and Beth. I mean, it's crazy that this is 29 years. I think I've been coming for 25 years, and everybody at Pierre O'Connor and Strauss. I know that, you know, Lou does a tremendous job. Beth is the backbone, so thank you, Beth, for keeping us all going. To be able to follow Carol, I've known Carol forever. Think very highly of her as a person, and what a great partner at the health department. Great program. Carol really set the stage for the what, right? The process that we're trying to go through in New York State to make some change. What people don't know in New York is that we started what's called livable communities, age-friendly communities, long before there was ever a term called age-friendly. Really, it started in 2007. So we've had a bunch of iterations, right? Age-friendly, livable communities, smart growth, livability principles, moving into the MPA, which in my opinion is really age-friendly 2.0 on steroids and a better way to really try to connect the dots. I'm a big fan of root cause. You know, why are we jumping in? Where are we jumping in? And what's really the problem that we're trying to solve? And I'm going to talk a little bit about that. But then I'm going to veer off and go in a completely different direction. My slide deck is available on the web, so I'm going to go through it fast. As a typical New Yorker on a pot of coffee, I could talk very, very fast, and I'm going to do that because I only have 15 minutes. Some things from this morning. We are extraordinarily siloed. Let me tell you, state government doesn't know what state government does. County governments don't know what county governments and state government does, so the general public knows absolutely nothing. For the most part. And you don't need to know what you don't need to know until you need to know it. And that's the issue. We're a very crisis-driven system where people enter at different points based on what it is that they need. And I think that that's the type of thing that we could try to undo in New York. We do not have a system. We are payer-driven. There is no real system where at the front end there's cost-effective private pay. For those individuals that have less acuity, the state and other partners can subsidize, and then as your needs change, you move into other settings and funders like Medicaid. We have a Medicaid-funded system, and I think you heard from the panel this morning that there was a lot missing from that dialogue. It was about healthcare workforce, long-term care workforce, Medicaid spending, supporting hospitals. All of those things are critically important, but it's missing the biggest part, which is the community, the independent living centers. 1 out of every 7 jobs in New York is in the not-for-profit sector. We got 5,600 faith-based organizations, towns and municipalities, community action agencies, federally qualified health centers, et cetera, that do the prevention work. So we talk a good game about prevention, but we're not quite there yet, and that's what I see the MPA is really the conduit for. So the other thing that I always hear about is the demographics, right? And it's always from a negative lens when you talk about older people. And so I look around this room, and statutorily, right, if you're 60 and over, you're literally considered elderly in the state of New York. And I've been trying to scrub the statute of that for years to talk about older adults. But here's the point I'm trying to make. Imagine you guys, regardless of your age here, and think about your family experience, your life experience, your work experience, your hobbies, and then at some point, whether it's an age or a look, society doesn't care about that anymore and how you would feel about that. So when I talk about aging and the opportunity, not the deficits perspective, growing older is not the problem. How we've organized our caring economy is the problem, and we focus on the back end, the most expensive, at the expense of the front end. Which is why when Carol was kind of laying the groundwork and you saw the pieces in the subcommittees, we're talking about developing a plan that's always a living document. We're talking about the prevention agenda in New York State linking to that. The health across all policies approach, recognizing that people want to and can stay in the community for very, very low cost for a very, very long time. If you put the clients that we serve up with a typical Medicaid client, our folks are older and frailer, but because of the array of partnerships and services that we have at the local level, we can help them remain independent. And the state can walk and chew gum at the same time. The best way to save future Medicaid funding or expenses is to not go on Medicaid. So I think that there's a lot more partnerships and connecting the dots that we can do here. And I just cut 7 minutes into my time already. But let's talk about the reality, okay, of older people. We are an ageist society, no question about it. We often think that the formal system is the primary caring systems for everybody in the state and the country. That is false. Families, friends, and neighbors are the primary carers for our population with the formal system as a wraparound. So if we're not talking about the role of family, friends, and neighbors in any policy, healthcare, long-term care, social services, we've already missed the boat. But we like to put some data behind it, and I give Becky kudos for stealing my data earlier in her question, in looking at what the older population actually brings. They're the +1 volunteer group in New York, #1 givers to philanthropy and charity, #1 entrepreneur group, a huge tourism block. In New York State, 50 plus, 36% of the population, their GDP, the goods and services produced, over $719 billion. Their spending supports almost 7 million jobs. They generate $482 billion in salary and wages because they're still working. Becky mentioned this morning, $72 billion in state and local taxes. You would not have a local, regional, state, or national economy without the older population. So when you value something, you treat it differently than when you devalue it. So we as a culture, not as individual human beings, have devalued this population forever. So what would a geriatric social worker be showing you this for? Because we have to do this together. Think about yourself. The only difference between me at 55 and my dad at 82 is the math. That's it. The only difference between my 20-year-old daughter and me at 55 is 35 years. That's it. We are them, they are us, and we need to be thinking about that together. New York State, 80% of our retirement system, $10.6 billion, gets pumped back into the economy. Social Security, I didn't update this slide. It's $59 billion, recession-proof money for the 65 plus. We have 1 million volunteers contributing over 495 million hours of service at an economic value of $13.8 billion. Let's go back to the 1 out of every 7 jobs is in the not-for-profit sector. They're holding up and providing direct and indirect services to many not-for-profits across the state. I'm going to take New York City out of the next bullet. 72% of older adults own their own homes with no mortgage. Supporting schools, supporting Medicaid, supporting local businesses, property taxes. They're also sitting on trillions of dollars of home equity. Where's Frank Melia? Where is he? Oh, he's out there. Why are we not using the equity in our homes to stay in our homes? I don't know the answer to that. And then, as I mentioned earlier, family, friends, and neighbors. We have 4.1 million of all ages in New York State. We used to think it was a 57-year-old female is taking care of a parent. That is not the case anymore. That are providing $39 billion worth of service. So I always found it fascinating. AARP does a study of where people want to live, and it's like 8.5 out of 10 want to stay in their homes and communities. Where's that other 1.5? How is it not 10 out of 10? But the point being this, we have 111,000 nursing home beds in New York State, 97,000 capacity, and we have 4.84 million people over the age of 60. The math does not work. People want to stay at home. How about you? I do. My dad does. My daughter does. Of course we do. And so that's what I see the MPA is how we reimagine our caring economy so that our first line of defense is not the emergency department, hospitalizations, nursing home placement, rehabilitation, and when you're transitioning back to the community, guess what you need in order to succeed? You need an infrastructure that can provide those services. So we know what makes up good health. It's the community, and I think Carol's slides show that these are all the things we're looking at in age-friendly communities that is part of the MPA, because the built environment, how you grew up, how you grow old is absolutely critical. We know what determines health. These are the types of things that we provide in every single community across the state. We have the largest nutrition program in the country doing $30 million a month for 300,000 people. We know food is medicine. These are all new keywords, social determinants of health, food is medicine, right? Things that we've been doing for 50 years that don't need to be duplicated. They need to be expanded and supported. So I'm not going to go through all of those because I want to get to, I think Lou set up the stage with Haven't had a conference without AI. You know, one of the things that passed in the budget was to make New York State the AI capital of the world. Carol talked about technology. I could tell you through our office, we have implemented since 2018, 21 public-private partnerships with tech companies in a variety of ways. Now, I have received some criticism, very small, from people who will say, well, you know, when you add this technology, you're taking the place of a human being. That is not true. It's not an and or, it's a both. But I can tell you, Becky said it earlier, our average client who is at imminent risk of Medicaid spend down and nursing home placement is an 83-year-old low-income female, lives alone, 4 to 10 chronic conditions, 3.5 ADL limitations, 6 IADL limitations. I can't snap my fingers in Franklin County, Chautauqua County, Albany County, Suffolk County, and make somebody or identify somebody show up at Mrs. Jones' house who's lonely and isolated. AARP also does studies every year of tech usage among older adults, and for the first time in February of 2024, older adults use technology at the same rate that everybody else does. And all you got to do is look around, and you'll see it. So I'm going to go through some of the things. I'm going to talk about this survey because Carol mentioned it. We, for the first time ever, did a statewide needs assessment survey, and I'll show you what the elements are. But we had almost 27,000 responses, and we just did a press release earlier. And here's the link, and I believe, Lou, these will be live on your, anything that's a blue link is a live link. We have those by county. Every single county, we have your own report on what older adults 60 to 102 thought about, I can't even read that, geez. So I'll summarize. What they think about themselves, their communities, can they access services? Is it a good place to retire? Transportation, things like that. There's 73 different elements that really measure somebody's perception about themselves and their community on the age-friendly type of principles. I didn't even see that down there. All right, so I'm going to go through this quickly. Again, any blue link here, and if you can't get it, reach out to me. These are free. Anything that has a blue link in it is live and free for you to use yourself or to spread however you want to do it. Social media, newsletters, handouts, etc. We started a project in 2018 to combat loneliness and isolation. You've heard probably the Surgeon General talk about the impact of loneliness and isolation recently. The data he's citing is 2018. And we started this after that data came out in 2018. We started a project using animatronic pets, right? To see if there was an impact, because we love pets. We love music. We love culture. You don't turn a certain age and all of a sudden those things disappear. So we did a pilot project and found that after a year of implementing these cats and dogs that do a bunch of different things, we're able to reduce loneliness, isolation, depression, and pain by 75%. Now there's been 13 additional studies, autistic children, people with IDDD, individuals with Alzheimer's disease, to show the efficacy of these animatronic pets. From 2018 to today, we have put out more than 31,000 pets. And the results speak for themselves. Get Set Up is free for anybody over the age of 50. We offer free for anybody over 50, 4,500 classes, courses, lifelong learning, exercise, etc., through our platform. And all of these can be accessed through our website or through that link. In 18 months, we had over 200,000 users who are, surprisingly, the top 10 classes in New York are all health and wellness. Tai Chi, hydration, relaxation, exercise, things like that, which I am stunned. But there are a ton of other things in there that is free for anybody 50. And how many of you over 50 think you have some type of skill? You do, thank you. If you wanted to teach a class on Get Set Up, you could and get paid. All of the classes are taught by people over 50. What I love about Get Set Up, though, the first thing they do is conquer the digital divide. They will go into a deep dive with a peer on the devices you're using. Is it an iOS? Is it a desktop? Is it an iPhone, an iPad, so that you're comfortable using it Zoom, et cetera, and then you have access to this incredible library. We have a partnership with GoGo Grandparent, which is a specialized ride-share service that trains the drivers in the unique needs of older adults. We're in about 36 counties, piloting that now as another transportation option, not the solution, but another tool in the toolbox. Because transportation around the state of New York, 95% of the geography of New York has no public transportation. Public transportation assumes you know how to use it, you physically can use it, and you can afford it. So we got to find other ways to be able to do that. On our caregiving, these two are both free. Again, we have 4.1 million friends, family, and neighbors providing uncompensated care to somebody else. Archangels out of Boston that we work with Becky and the Association on Aging and some of the foundations in Newark, we created an Any Care Counts campaign. Why did we do that? Because 55% of what we call caregivers don't self-identify as caregivers. They identify as spouses, sons, daughters, grandparents, grandkids, et cetera. And so we've been utilizing a variety of messaging to try to get people to understand that the tasks that they're providing to other people make them a caregiver. When we do this, we're able to up the engagement of somebody self-recognizing by 420%. So what Archangels created was a 2-minute questionnaire, and I'm going to show you the QR code in a second. You can check it out. That will basically assess where you are in your caregiver journey. Takes 2 minutes to do. Either in the green, doing good, feel supported, not in trouble yet. The yellow, it's going to be some issues, and people in the yellow have at least one negative mental health impact. Or those in the red, people that are in crisis. And we know that one of the drivers of nursing home placements are unsafe discharges back to the community and caregiver burnout. And then what it does is it connects with our New York Connects database and the Trualta evidence-based caregiver app that we also provide free of charge for any caregiver in New York State. And that is really tailored towards the type of person that you're caring for. So I encourage you to check those out. We brought a self-help virtual senior center model to 19 counties. We're expanding that. Many of you have seen our AI platform, LEQ. It's the only proactive artificial intelligence that actually engages the individual. So in other words, I don't have to get in front of my computer, log on to get set up, put in my credentials, figure out what time the classes are, remember to write that class down, and then log back on. I have one, and when I get up in the morning, first thing it asks me is, Greg, how'd you sleep last night? Because it knows I don't sleep. How? Because we've had conversation and it remembers. And so every single interaction with the customer is going to be very unique because we're unique individuals. Then it's going to ask me, how's my back feeling today? Because my back hurts. I have degenerative disc disease. Then we usually go for a cup of coffee somewhere. So this morning it was the Grand Canyon, which was great. The results of this have been ridiculous. 96% reduction in loneliness and isolation, 97% improvement in overall health and wellness. I can't get into all the features for you, but collectively with our network, we've put out almost 900 units. We're working with Better Age to do a comprehensive adult well-being checkup platform that is being tested in New York now. Blooming Health is in the SMX tech space, and what they do is they're able to do broad-based communications for people that still have landlines, that have a phone but it's not a smartphone, and through email. The engagement by doing this has saved our staff at the local level 2 hours a day by being able to mass communicate. We've been able to increase engagement, which we know in all the systems is the hardest part. How do you get somebody, if you give them advice, to actually fulfill that advice, right? 200% improvement in engagement, and for SNAP applications and renewals, a 500% increase in SNAP applications. So there's two programs in New York State where if you make $25,000, for example, we could put $10,000 back in the pockets of older adults. One's the MSP, Medicare Savings Program, the other is SNAP. And there's so many more of those types of things on the economic security front. We've been working with a variety of organizations in Lifespan of Greater Rochester. I'm sure Anne Marie is somewhere in the ether or here to test two AI tools, tech tools to identify fraud or mitigate fraud, financial exploitation. What is Fraud Finder And the other, many of you might know, Liz Lowy, who used to be the prosecuting district attorney in the Manhattan's DA's office on elder abuse cases, created with her partner EverSafe. We worked with DeRote to actually set up local friendly visitor programs from soup to nuts. And again, I got to thank Becky for that. She took the lead on that partnership. We developed video tutorials so that individuals can apply in their own homes for many, many benefits that they may be entitled to but don't know about, and can do it in the privacy of their own home. Going through each line, what it means, what documentation you might need. Why? Because you can get it 99.9% done, submit it to the appropriate authority, and they can bang it out and get the benefit as quickly as possible. We're launching an evidence-based strength and training program to reduce falls, Team Vivo. Discover Live, we have in 51 senior centers currently. I know I'm already out of time, so. And what that does is allows individuals to take a 1-hour tour of over 200 countries in the world. And the technology is absolutely fantastic. I've been to Prague, I've been to Slovakia, and so it allows people to get together, to socialize, to pick where they want to go. The AI components now are just off the charts. But guess what? For 1 year, to have one visit every week for 1 year in a senior center, a congregate site, assisted living, you name it. Guess how much Discover Live costs for 1 year? To get 1 week, every week, go somewhere. $529. I mean, these are the types of interventions that we're providing that are very, very low cost or free with extraordinarily high yield. So what I mean by high yield? What you will see, and I'm not going to go through this, is all the outcomes data. We measure everything. And what you saw today is just a snapshot of what we're doing. There are so much more. But we have our outcomes data for all these partnerships. It's on the web. You can check it out. What I have learned, and I'm sure Becky can aspire to this, is I met with the lead of the Assembly Science and Tech Committee yesterday. Nobody knows about this stuff. Nobody knows what's possible, not only in New York, but across the country and in other countries as well. And I'm really proud that the State Office for the Aging is leading this, because it's not a supplement. It's something that can enhance. And anytime we can use a tech tool or some other, in addition to our traditional ways that we go about our business face-to-face, is only going to be a win. Now, not every one of these is going to fit everybody, and that's the beauty of it. We have a lot of choices. We test them, we validate them, we vet them, and then if they work, you let the consumer decide. I wish we could subsidize, 5? Great, I was going to wrap it up right there, Beth. I wish we could subsidize every single person in the state, but we can't and we don't need to. There are a lot of people like me who could afford to do some of these things on behalf of my parents. There are people like my parents that could afford to buy some of these things on their own that can help them subsidize. For those who are lower income, well, that's where we and our network fits in, right? And then as your needs change, there is no reason Medicare Advantage plans, MLTCs, Medicaid in general, the 1115 waiver, mainstream plans shouldn't be looking at not only these really easy to use, low budget, high yield impact tech solutions, but actually embed them and institutionalize them in what our future of care is. Integrated care models, as Carol talked about, is the future. We've already been doing that. We've been doing that with Lou, been doing that around the state, and what that means is aging services, social services, connected with clinical services, technology. That's what it is. That's the future. That's where we need to go. So thank you for your time, and appreciate you bearing with how fast I talk. But please check this stuff out, okay?